invite you again. Thank you so
Oh, I
much.
see. Okay, well, thank you.
But this is maybe yes, we cover it in visiting professor, not like international conference.
Lovely. Yes, that's great.
Is it okay, Prof? We will wait for maybe 5 to 10 minutes to let them join us.
Yeah, absolutely, no problem.
Okay.
I came in early just to check the technology, but I wasn't expecting to start just yet, so that's fine. You just let me know when you're ready.
Thank you so much, Prof. I will start it in 5 minutes.
Okay, I'll just pop my camera off in the meantime.
Yes, yes, Prof. Well, okay, good afternoon, everyone. Good afternoon, Professor.
Good afternoon. Hi there, everybody.
Yeah, hello, Professor. Thank you for coming. Thank you for joining with us. I think since our time of reference, it would start at 3 o'clock, but because there are some limitations, so we are going to start our lecture today. And let me, as the moderator today, will open our lecture. First of all, today we have special agenda. My dear students, visiting professor from University of Lincoln, and I'll be the moderator. And I would like to greet our professor, Prof. How are you, Prof?
I'm very well, thank you. And I'm
Yes, thank you.
delighted to be here. Thank you for inviting me.
Yes, Professor. And we would like to say thank you so much, Prof, for the opportunity so we can create this program. And I also ask for apologize because my rector, my director cannot be able to join us because she already has another agenda. So let me represent her to deliver her greetings, her welcoming you to our program today.
Thank
And
you.
I would like to remind to all of you students to can able to put your camera in on, so you can open your camera while we have a lecture with our Professor Dr. Ros Kane. And then before we start, let me first read the curriculum vitae from our professor and allow me to share.
Okay.
Wait. Is it displayed in your device, everyone? My dear students, can you see the slide? And I mean, can you see the file?
Yes,
Yeah.
Mr. Deri.
Thank you so much, Ma'am Arian. Okay. I think this is the from the previous year, but it's it's okay. This is our second time to have our professor again. It's such a big honor, and also it's big opportunity for us to have you again, Professor. Okay. Here I would like to share the curriculum video from our professor, Dr. Ros Kane, and then maybe I would like to read the latest one, like day from the previous substantive appointments. In 2021, Professor Deri's appointment or title visiting professor in Suratani Rajawali University, Thailand, and also SRU is also our campus partner between Institut Kesehatan Rajawali. And 2019, Associate Professor and Director of Research, School of Health and Social Care, College of Social Science, University of Lincoln. And there's a lot of experience that inspiring us, so amazing. And I think it will take so long to read all, but I will read the latest one, from each component of substantiation. And the qualification from our professor in 2005 already got a PhD or done PhD by research in London School of Hygiene and Tropical Medicine, University of London, and also for the master degree in 1996, medical demography with the dissertation thesis, sound preference and infant mortality, and also from the London School of Hygiene and Tropical Medicine, University of London, and for bachelor degree in 1994, and this is the major anthropology and geography from University College London, University of London. And for the membership of professional bodies, Prof can also there's as member as in some organizations that you already can see from this presentation or this file. Date 1989 until current, as the Nursing Midwifery Council, Adult Nurse and Registered Nurse Teacher, and also 2002 and current Higher Education Academy or Advanced HE, 2014 current European Academy of Nursing Science. and so on, and externally facing profiles like ORCID. And I think this is the update one. There is increasing or improvement in publication from our professor, but from previous or last year, Scopus, there are 33 outputs and 458 citations with high index 13. And then the Web of Science Researcher ID, there are 23 outputs and with 273 citations and high index 10, and Google Scholar almost 10,000 10 citations. It's amazing. And HI with high index 13 and I-10 index 16. And for the personal major honors and academic distinctions, our professor 2021 personally invited to take a position of visiting professor Suratani Rajawali University, Thailand. And this was in recognition of her ongoing work with the Faculty of Nursing, where set up a memorandum of understanding between the organization in 2018. And also she has supported the staff and so far has achieved one joint publication and have another under review, and they are now exploring the possibility of setting up joint awards and PhD supervision between the organization. In 2021, our professor was accepted as a reviewer on the UKRI Future Leaders Fellowship Program, and so on. Okay, and for the teaching responsibility for the last 3 academic years, so we can see the role or the contribution from our professor. She led the course like ACA Bronze Award, which open to health professionals across the East Midlands, and also our professor centrally involved in all planning, coordinating, and delivery of session plus marking. And this is a very high profile externally facing course and coordinate it in collaboration with the University of Nottingham, who run a sister pre-PhD course. And also all guided by an East Midlands steering group involving a large number of clinical strategic partners, of which Prof. Ros is the member. And it responds to key stakeholders and national developments. And this year applied for a modification to the assessment to allow much greater flexibility and choice. The interns can now opt to submit a draft article or PhD proposal, which they can then use for submission to journal or funding body. This innovative and responsive change has been extremely well received. And also any additional, there are so many achievements that achieved by our professor. And also there is a publication, research and scholarship and professional practice output. There are so many books that are already published by our professor, such evidence-based practice for nurses that already integrate in our topic today. And our professor will share to us about our lecture today about how to improve the quality of education and clinical practice through integrating the evidence-based practice for nurses and healthcare professionals. And then there's so many, so I hope my students can maybe access this book or maybe the article, so we can together can increase the citation of our professor. And then referred publication in journal and so on. So many, I think it will be take much time. So I think maybe that's all for the brief curriculum vitae from our Prof. Ros Kane. Once again, it's amazing, Prof. So the verbal is so impressive. I think we all here not can wait for your great explanation among the topic that I already mentioned before about the quality, how to improve the quality of education and also clinical practice through integrating evidence practice. So can you start your lecture, Prof, right now?
Sure, I will do. And thank you very much for that.
Yes,
Very grand introduction. I could have sent you a shorter version of my CV. I will probably do that next time. But it was very nice for you to highlight all those things. I think just before I start to say two of the key things that I'm really proud of is one of them, the work that we do in collaboration with the University of Suratani in Thailand, because as part of that relation, what we've started to do is work together with some of the academic staff there, who in that department, they are all nursing staff. But in the UK, I work more broadly with other health professions as well. But what we've started to do is try to work together to support publication. So since last year, we've actually had, I think, 2 more publications that have come out through that relationship, but also stretching out into another university in northern Thailand as well. So it's really beneficial to have those international relations really formalized, I think. So it's really great to be able to participate with your university as well now. I think, and the other thing is a lot of what I do in terms of the teaching is delivering research training and evidence-based practice methods for clinicians. So, and I'm going to talk a bit more about this. In the UK, there's a really big drive to help clinicians, particularly nurses, midwives, other allied health professions, to engage in clinical in research, so that their research can be driven directly back into their own clinical practice. So the current sort of drive is not about having everyone moving over to become university lecturers, but actually helping people to stay in clinical practice and firm up their research skills so that they can work directly with building evidence into practice. So that they're the 2 kind of key things in my role that I'm really sort of driving forward at the moment. So I will just share my screen, and I think I'm going to talk for about an hour. Is that still okay, as we've started a bit late, or do you want me to finish on the hour?
It's okay, Prof. I think it's regarding our schedule. It will be finished in an hour because you already have another agenda. It's okay. It will be delayed.
Okay. Well, I will. You can tell me to stop if I'm talking too much. It's no problem.
Okay, Prof. Thank you.
Okay. So this slide's coming through. Okay. Yeah, you can see that.
Yeah, we can see.
Great. So yes, so just some of the things that I really want to touch upon. And please, if you do have any questions, I think we're going to have a little bit of time for discussion at the end as well. So you can sort of maybe think as we're going through. But I just want to maybe touch upon some of these areas depending on the time. But thinking about why our practice as health professionals needs to be based on the evidence. I'm going to think a little bit, and I'll put some exercises as well that you can do about why we need to be able to think quite critically when we're reading research evidence and not just take it as fact. I'm going to introduce some epidemiologists to you that you may already know before. And then really think about what evidence-based practice means. And then I'm going to also touch on quickly the concept of clinical academic careers, and I'll explain more about that. So just to start with then, this is just an example. And this is an example of how we need to be careful as health professionals, not just to understand things at a surface level. We need to really be able to dig deeper into the literature to be able to really unpick what is actually going on. So this is an example. It's a made up example. This isn't really found in the evidence, but it's just to make the case really that if you were to read this, and I'll just read it out, it said the recent use of antacids and stomach cancer. So this is reporting on a study that is trying to look for a relationship between antacids and stomach cancer. And it's reporting on a case control study of people diagnosed with stomach cancer. And they found that people with stomach cancer had a much higher use of antacids in the time leading up to their diagnosis than the matched controls without stomach cancer. So they jumped to the conclusion that the use of antacids is a cause of stomach cancer. Now, if you just take a little bit of time to think about that, that might be the obvious, conclusion to draw. But obviously, if we dig a little bit deeper, what's actually probably going on is that people start to take antacids because they've got symptoms. to alleviate their pain. So it's actually the other way round. So to draw a conclusion that antacids are a cause of stomach cancer is just doesn't make sense. It's a really simplified example, but it's just to really think about when you're reading the academic research literature. Don't just take it as fact when you read the results and the conclusions. It's about really unpicking the value of that study, looking at the methods, how well it's been done, so that you can draw your own conclusions, and criticizing the published evidence as well. And I think particularly, as you probably will find when you're doing your assignments, throughout your degree and beyond, you get higher marks if you can show that you are critically analysing the literature and the evidence that you're reading. So that is just one very simple example of that. There is another one, but I won't go into the details. You could possibly have a look at this one after and have a think for yourself about what's going on in this scenario and what actually the evidence might be saying. So it's really just about reading between the lines, I think, is really important. Just a little bit about my own interest and how I got interested in research. When I qualified as a nurse, which was in the 1980s, there was very little opportunity to do research if you were a nurse. It was very much a clinical role. You would work largely in hospitals. It was very unusual for people to work directly on the community. For example, you would maybe work in hospital for a couple of years and then maybe progress onto community nursing if that's what you wanted to do. That's completely changed as well. You can go straight into community nursing and you can be a nurse and never work in a hospital actually these days. The nursing has changed beyond all recognition, I think. I qualified in a good way. But I think the idea of doing research just didn't exist. And if you wanted to do research as a nurse, you had to pretty much leave the profession and become an academic in a university. And that is changing too. But my own personal interest came up, I guess, when I did my master's degree, because there was quite a lot of research methods within that. And as part of that, I got to know the work of some of these very famous epidemiologists. Richard Doll and John Snow are much more historical now, but they did really groundbreaking work in their time. Richard Doll was the first person to show an association between smoking and cancer, and John Snow's work was very famous for mapping new methods in epidemiology, which he did around the cholera outbreak in London. And these are very, very famous case studies now. So I've put the links. I'm afraid I'm using Wikipedia here, which is very bad practice, but just if you want to know, if you don't know these people already, it's really worth just having a look at the groundbreaking work that they did. But also the chap in the picture is the man at the top. He's called Jerry Morris. Now, I was really privileged some years ago to actually work in the office next door to Jerry Morris. And to my shame, at the beginning, I didn't know who he was. And then I got to know, and I realized he was actually a really, really successful epidemiologist. And he was the first person to make an association between physical activity and health, particularly sort of coronary heart disease. And he did a groundbreaking piece of work where he compared over time the health of bus drivers in London compared to the bus conductors. And the conductors, the difference being is that the conductors on the bus, who are the people running around, going up and down the stairs, selling the tickets and so on, are busy all day on their feet, active, where the drivers are sitting, driving all day. So they've got very different levels of physical activity. And he followed a cohort of drivers and conductors over time and showed associations with their physical health related to their levels of activity. And he was a really great colleague and an inspiration. And he died a few years ago, but he died just a few days short of his 100th birthday. So he lived a very long and healthy life, and he was a great inspiration to me. And then at the bottom, Chris Whitty, who some of you may have heard of, he is our current Chief Medical Officer for England, and he became very well known during the pandemic. He was on the TV every day, and I didn't realize until later on that we did our masters at the same time at the same organization. So he didn't know me personally, I didn't know him personally, but we had an association. So again, a great inspiration. However, I think the one thing to note about all of these great epidemiologists is they're actually from medical backgrounds, they're medical doctors. And of course, what we're looking at is developing research skills in non-medics, so nurses, midwives, allied health professions, pharmacists, physiotherapists, and lab-based people as well, so outside of medicine and dentistry. So just a bit of background there about some real inspirational researchers in health, and I think do go and have a look a bit more about them. And I did touch on some epidemiology earlier in my career. I did quite a lot of training in epidemiology, which I think has really come to the fore again through the pandemic. Previous to the pandemic, nobody really knew what an epidemiologist was, but now, of course, it's really better appreciated and better understood. I'm not an epidemiologist. I can't claim to be. It was a long time ago that I even did any sort of courses on it. But I think for me, it just flagged up an interesting dilemma, because as a nurse, I used to be a gynecology nurse, so I was working in women's health for some years. And as a nurse, your unit of interest, if you like, is the patient. You do everything you can to advocate for the patient in front of you. And as a clinician, that will be the norm. That will be your normal way of working. But with epidemiology, and to some extent other disciplines such as health economics, your unit of association is the population. So you tend to try to make understandings of associations between behaviours and health outcomes, but very much at the population level. So what stands true at the population level might not stand true at the individual level on every occasion. For example, you often hear people saying that somebody smoked but still lived a very long and healthy life. There is no doubt an association between smoking and ill health, but that doesn't apply to every single person. It's about averages. So actually thinking as a researcher is almost an opposite way of looking at the world than thinking as a nurse when the individual person that you're concerned about. So for me, it was a bit of a shift of thinking, becoming a researcher. And now I think I'm sort of in the middle because I can see the value in both approaches. But I just wanted to flag that up as an interesting dilemma sometimes. And that's why often in public debate and public policy and health policy, researchers and clinicians are often at odds because they're actually arguing for different things, ultimately for the greater good, but from different perspectives. So it does make for interesting political debate. Okay, now I'm going to go on to think about why we need to be researchers, why we need to be research active as clinicians. Now, I've got quite a few slides here that I'm not going to go into all the detail of because it's very UK based and it's quite historical now, but I just wanted to tell a bit of a story about how over the last probably about 20 years in the UK, it's become much more on the political agenda that actually research is central to everything that we do. So there are lots of policy documents that have come through our Department of Health over the last 20 years to really focus on actually research isn't something that it's a luxury. It's not something that should be added on. and thought about afterwards, and something that we have to do in our extra spare time, but actually it should be central to our daily practice as nurses and allied health professions. And it should be a core business of the NHS. And so in some ways, there is an argument now that all clinicians really should be research active at some level. Now, for some people, that might mean becoming a full researcher and principal investigator on big studies. For others, it might be just engaging with the evidence so that before we interact with patients, we're doing it in an informed way based on clinical best practice, and not just on what is tradition and what we've always done. So there is really a drive now to have all health professionals really research active and savvy. And this has been driven through, as I say, national policy in the UK, from initially a sort of ideal perspective, in that this would be great if we could have all this, but actually, how do we get there? How do we equip nurses and other health professions with the skills and the time to be able to do this? And we are now starting to see programs to help with that transition to a different way of working. So I won't go into this detail, but this is just one of the first projects, really, national projects in England that started to really look at this. And I'm really proud to say that two of my colleagues from Lincoln, who they've both retired now, but they were really part of this group that were really central to writing this report. And these reports are available if you are interested in looking at the background. But it was really looking at why we need nurses to be research active, and possibly, sometimes to work in joint roles between health and the academic world, but also some of the problems and the barriers to achieving that. So there is a lot of talk about clinical academic careers now. Internationally, this terminology is starting to sort of take hold. And that's where I'm involved in training programs in England to help, as I say, support health professionals to become research active, but actually with a view to them staying in clinical practice. So the idea of a clinical academic is somebody, so a nurse, a midwife, an allied health profession, who works in clinical practice and research. So it's about having a foot in both, if you like. So really providing leadership and innovation in terms of clinical practice, but also in terms of, being a real advocate for evidence-based healthcare as well. But a really important thing is that we're talking about remaining clinical, but just becoming more research active. And that's difficult. But as I say, one of our first sort of government documents was back in 2012. So over and we've been really striving the country, and we're not there yet. We're quite a long way, but it is that momentum. So this is, I suppose, well-recognised definition of a clinical academic. And this definition comes from the National Institute for Health Research, which in England is our main funding really for health government funding. And it's a very rich source of funding for health research. And actually, they also fund training as well. So it's about clinical academics and clinically active health researchers. They work in health and social care. So this also includes social work professions to improve, maintain, recover health, while in parallel, researching new ways of delivering better health outcomes for the patients. And the really key thing is because they remain clinically active, their research is really grounded in the issues that matter. So as a health profession, you're the best person to know what research needs to be done, because you can spot what's not working well in clinical practice. and then that can flag up some questions that need to be asked, and therefore you've designed a research study, or you've thought about a research study that needs to be done. So that interface between clinical and academic practice is really, really, really important. This is just some a report it was done a few years ago now, and I won't go into all of the details here, but I just wanted to flag up that this report really was quite instrumental, I think, in showing the actual benefits to health organizations, so to hospitals and big health organizations, to show the benefits of having clinical academic roles. So sometimes there might be, from the health side, there might be some reluctance.
Iya, nanti bentar teh minta sakit.
Because they don't know why, they don't know if it's a good investment. And this report really sort of turned that argument around to really show actually it's worth doing, because there's so many benefits to the organization if your staff are well informed, and clinicians who are thinking on their feet and making their decisions based on evidence, rather than just what maybe a more senior health profession is telling them to do, or what they've always done. So it's about that ability to really critique practice and, you know, justify your decisions as a nurse or other health profession on justifying your decisions based on the published research. Okay, so that's just the original document, which it became known as the Finch report, and really this is the report that paved the way, I think, for this way of thinking and this way of working. And it was based on, this report was actually based on a piece of national research itself. So they did a lot of consultation with experts in healthcare to come up with the recommendations. And this has been really groundbreaking in terms of moving the thinking forward. And I know I do quite a lot of work internationally, particularly in Europe, and I know lots of other countries in Europe are doing the same. Some are further ahead than the UK. I know I work closely with a colleague who's a professor in Barcelona, and she's worked really closely with the clinicians in the hospitals to try and get pay scales, for example, aligned, so that if a nurse gets a PhD, they get an increase in salary in the health sector. And in the UK, we haven't got there yet. Often nurses do master's degrees in research, PhDs, but they stay in clinical practice on the same grade. There's a lot of work that we need to do there, because that's a disincentive really for people to engage in research, and particularly for their own professional PhD level development, because it takes a lot of personal investment. So we've got a long way to go, and it's very complicated because HR departments across different organizations need to work together and make sure they're not contradicting in terms of their job descriptions and so on. But really there is a big push to have much more infrastructure to support research active clinicians. There's too much detail to go into. It's really just to flag up that now we have in the UK, the national government funds a whole suite of training programs that are specifically not for doctors and dentists, because they've already got theirs. This is for nurses, midwives, and the other allied health professions to train in from the point of graduating right through to becoming a very senior clinician at a consultant level and having a post PhD research as well. And there are funding streams now that help to deliver this research training for people that are staying clinically active, which has been a huge step forward, I think. And there is just there, for those that are interested, obviously this is just from England, but if you can have a look at that, and it just gives you an example of some of the funding opportunities that are starting to get rolled out here to help with research training. And the other thing that has just really come to the fore here is just a couple of years ago, both in allied health professions and in nursing, so separate documents, but they came out round about the same time. And these are national policy documents that now need to be, the influence and should be implemented locally. And these are research plans for nurses and allied health professions. So this is really strategic level government, not investment, because there's no money attached to this, but it's about just driving the practice forward, reiterating that actually research is central to what we do. And I've put the link, I think, to these on in the slides later on. If you're interested in looking at the detail, but it's really about thinking, okay, this is nursing, you know, research is nursing, nursing is research. And there's lots of different areas and different levels of research, but there is a real drive for really trying to develop this infrastructure. And why do we need evidence-based practice? Why do we need to keep up to date? Why do we need to have our practice informed by evidence? Well, I think, you know, there's lots of reasons for that. And one of the reasons that we need to keep up to date is because actually things change. What used to be good practice 10 years ago possibly isn't good practice anymore. If we think about, even just in my lifetime as a nurse, if somebody was coming into hospital for surgery, they would come in at least 3 or 4 days before, and they would probably be asked to stay on bed for a week after a major operation to recover. And of course, that's now completely the opposite to what happens. We're trying to reduce hospital stays to be as short as possible because you're more at risk of picking up an infection if you're in hospital. So there's a big drive to get people home soon and to get people mobilizing, helping people, even after quite significant surgery, to mobilize as quickly as possible because of the complications of being inactive. And so even in that period of my career, you know, the evidence has completely turned around the way we practice. So things change, the population changes. We've got an aging population in the UK. There's going to be a huge demand on services that wasn't there before. People are living longer. We've got better early diagnosis, better treatment, which is great. And it's resulting in a huge change in the demographic. So we need to keep up to speed with the evidence to keep our practice appropriate for the current population. And also patient expectations are really changing. Patients are much more informed than they used to be. They, you know, the use of Google, for example, we all have a quick Google, I'm sure, before if we've got health problems ourselves, we inform ourselves, and patients come equipped with questions. And as health professions, we need to be able to answer those questions, and we need to be able to answer them in an informed way based on what is the current evidence in relation to that. And so I think this is possibly maybe something for you to think about afterwards, but I think it's worth really thinking about how we can use the evidence base as nurses. We can read the literature. It's sometimes difficult to keep up to date with all of the literature because so much gets published every day. But we can also contribute to the evidence. And I think that's really important, that we are proactive as health professions. We're not just recipients of the literature, but we can actually write ourselves and we can publish ourselves to contribute to that debate. And I think as an academic, it's important, we have to publish all the time. But as as students, you can publish. We work quite closely with some of our students to help them if they do a really good review of the literature, for example. We work with them to try and get that published as well. So there's no reason that you can't start to think about publishing, even while you're, for some of you who are still students, that's, you know, a possibility. One example is, you know, even if it's a piece of coursework. I remember some years ago I was doing a piece of coursework and I handed it in and you know, got the marks and passed the module, but actually I thought this might be of interest a bit further afield. So I got in touch with a journal and I actually got it published. And it's become one of my highest cited publications, actually. And similarly, sometimes we work with students who get them published. You don't have to be working on a very high level, national, randomized, controlled trial to get your name in the published literature. You can publish something very small scale and local if it's making an original contribution to the debate in your area. So I think it's important to start thinking about that now, really. We've done a lot of work here. One of the courses that I lead on, we've actually changed the assignment for the students so that what they produce is an article that's ready to be sent to a journal, and then we send that off with them. So it's a good way of getting students to build their CVs and to build their profiles of publications. So something, I guess, to think about. But you can also write up all sorts of other things, examples of good practice. You might, in clinical practice, you might do a small quality improvement project. And if it works, then, you know, evidence it. And then other people can benefit from your hard work and your good practice. And that good practice might be able to be picked up in different parts of healthcare or different countries and so on. So often we do clinical audits, but sometimes they're relevant for further afield than just our immediate clinical environment. So, you know, it can be, it's almost like whenever you're doing anything, a contribution to an assignment or something original in clinical practice, you can think about how to report on it in the public domain. And I think as you go through your careers, it is important to have, you know, an academic profile. So build up your list of on your CV, build up your publication outputs, and you know, it's really good for your own development. Now, just want to, I don't know if any of you were on this meeting when I spoke last year, so forgive me if you were, because I would have used this slide. I'm sure I always use it because I think it makes a really good point. I think sometimes, you know, for us as individuals, it's impossible really to keep up with the current literature, because this is so much is published, and somebody has worked out that if everything that was published, and this is just in health journals, there's so many journals, if this was just in health journals, if you printed everything off that was published in 1 year and made a big pile, it would be higher than the Empire State Building in New York. So, you know, that's a lot of literature, that's a lot of reading. So it would be, I think, 3 times as high as the Empire State Building. And that translates into thinking that if you try to stay current by reading 2 articles every day, which I think is a lot, we probably don't manage that, you would fall 55 centuries behind in just 1 year. Or another way is that you would have to read 5,500 articles every day just to keep up to date. So there's so much literature out there, it's impossible to keep up to date. But I think that's one of the reasons why literature reviews are really important, because if you do a really good systematic literature review, what you're doing is bringing together everything that's been written on a certain topic and you're condensing it into one document that is really useful for other people to read, because it's saving them having to read 5,000 articles a day. It brings it all together. And actually more and more now we're seeing literature reviews being published, and they're really, really useful sources of evidence, and that any of us can do, because it's a case of reading other people's work and bringing it together in a useful way. And there's just so much evidence out there, and it's not just, I think, you know, especially with the internet, we see this, we've got access to so much information, and it's not just, you know, primary research, it's conference proceedings are often published now as well. There is just so much out there. But I think with any of this, it's really important to be mindful of keeping critical, reading everything through a critical lens, and particularly, you know, editorials into journals, they're just opinion pieces. So they're valuable, but it's somebody's opinion, which might not be evidence-based. It might be based on their, you know, own views or whatever. So with everything, I think it is really just about not just taking it at face value. And because I think another reason is academics, there's a lot of pressure for people to publish. People get promoted if they've got lots of publications on their CV. In the UK, they have about 7 years, they have a really rigorous national assessment of outputs. So universities get government funding based on how much they've published, but not just how much, but actually the quality of those publications as well. But there is a really huge pressure for academics to publish. And there's so much supply that you just need to be really careful when you're reading the literature that it is solid. And the more you understand about research methods and study design, you know, you can apply that knowledge to critiquing the research that you do read. Journals have all got a peer review mechanism in place. So when you send an article off to a journal, it usually gets looked at by at least 3 independent people, and they comment on it and decide whether or not it's worthy of publication. And if they see a flaw in it, in the analysis, you know, it won't be published, or they'll ask you to correct it before it's considered for publication. And so that's meant to be a sort of safeguard in the only, you know, evidence that's been tried and tested reaches the public domain. But it's not always 100%. So I think, you know, it's just about really having a critical lens on everything that you read. So we hear a lot about this idea of evidence-based practice, and what do we really mean by that? I think this is, S.Kep was probably, this is from the 1990s, but he's possibly the most sort of published author, or certainly one of the early authors to sort of introduce this concept of evidence-based practice. And initially it was targeted at medicine, but of course this applies to allied health professionals as well. So we hear what S.Kep's definition was, that it's evidence-based medicine. It's the conscientious, explicit and judicious use of current best evidence in making decisions about the care of individual patients. But interestingly, he recognises, even back then, that the practice of evidence-based medicine means integrating individual clinical expertise with the best available evidence from systematic research. So he's acknowledging the importance of clinical expertise to work together with the research evidence. So there is something about that building up of your practice and your expertise over time, and that intuitive knowledge that you can bring to the debate, which I think is quite an important recognition. But I think breaking that down a little bit, because what is missing from that original quote is actually the patient. And as you will be aware, I'm sure, over the last sort of, I suppose, 20 or more years, there's been a real push for patient-centered approaches to healthcare. So actually, you know, nothing can be done without the consent of the patient. So the patients need to be informed about what's happening to them in terms of their treatment and so on. So actually having that acknowledgement to the patient, when you unpick and break down the original quote from S.Kep, is very, very important. And I won't read all of this. If you're interested, you can maybe look later, but you will see that in breaking down what he meant by individual clinical expertise, it is about actually also thinking about the preference of individual patients in making their own decisions about their clinical care. So, you know, it's really good to have that acknowledgement early on as well. I just want to introduce you to this chap, if you don't know him already. He's from the UK, he's a medical doctor, but he's also an epidemiologist. And I've just put him on there because he's a really interesting person to listen to. I think possibly underneath the slides, I've put some links to, he appears quite a lot on YouTube, and he's done TED Talks, and he's a very entertaining speaker. And he's written quite a lot of books as well, as you can see. And he's a really great advocate for evidence-based practice, really, and for thinking about, you know, reading between the lines and not just taking things at face value. So I would really recommend having a listen to some of his work. He's particularly criticizes the big pharmaceutical industries. He's very skeptical about investing in big investment and the potential bias that can introduce into healthcare. So he's got some very interesting videos on that. But just generally as well, his work.
I'm sorry, Prof.
Yeah.
Allow me to remind you your time, 5-minute lapse. Thank you.
5 minutes. Okay, that's fine. That's fine. So I'll leave you there with Ben Goldacre, but do have a look at his work. And just to see, you will often see this triad of evidence-based medicine. So it's bringing these three things together: clinical expertise, best academic sort of research evidence, and patient values. So I think with our clinical practice, it's always having these three things in mind. Briefly as well, I want to introduce you to Fulford, this man, this academic, clinical academic, because he's a psychiatrist by background, Bill Fulford. He has been really revolutionary in also throwing into the mix here the concept of values-based practice. And we won't have time to go into too much of his work, but I think I've put some references to him. He's talking about, it's not just about patient preferences, it's about patient values and our own values as health professions, and what do we do when they're at odds with what the patient values and wants. And he's done some really kind of really thought-provoking work, which is really worth looking at too. Okay, I'm going to just wind up now, but I think there are some more slides that I've put on if you want to think about it. It's more about thinking about publishing your work. So there are some more slides on there, but I just want to possibly talk through this slide, which is, you know, lots of health professionals say actually they see research as something that is not for them, that it's something that they're not familiar with or might not be able to do. But actually, when we think about what we do as healthcare professionals, it's the same as what we do as researchers, in the sense that when you have a patient in front of you, you do an assessment, you plan their care, you deliver and implement their care, and then you evaluate their care. And it's, in a sense, every day, that's a mini research project, because that's what we do in research. We assess what the problem is, find out what's known about it and try to test something, find out if it works or not. So it's just doing it on a bigger scale. So I think some people are intimidated by engaging in research, but actually, if we think about it, it's something, that critical thinking we do every day. And also because there is this whole concept of evidence-based practice or research-informed practice, but actually the alternative view, which I think is a really important one, is the opposite. It's practice-informed research. So it's about practice and clinicians thinking actually what is the research that's needed. And your observations from clinical practice are what then informs the research. So it's flipping it on its head, but I think as clinicians, we're in a really, really strong position to be able to identify what is needed and inform the research. So I'm just going to, before I finish, I'm just going to flip through. I won't go into these slides because, as I say, they're writing and they're there if you want to have a look at them. I just wanted to flag up, though, a couple of things. There are some references there. The one in yellow at the top is the Ben Goldacre work. The other one is actually my little book on evidence-based practice that I've worked on with a colleague, which is here. There is a new edition of it now. These are the older ones. There is one came out last year as well. This is just some wider reading if you're interested more in the history. And that's just for you to have a listen to a little song. I won't play it now, but it's from a bit of a take from a really popular Coldplay, popular band who have made a little song about evidence-based practice, which is worth listening to as well. Okay, so I think I will end there, and I'm very happy to have a chat. Any questions? Very happy to
Yes, thank you so much, Professor, for such a great explanation and really explore our insight about how important this topic, and because I agree with you, it's really relevant even to undergraduate students, master student, or even healthcare professional to integrate evidence-based practice in our education and clinical practice, right, Professor? And I think since you already done deliver your explanation, we are going to the next section. Is our next section is for discussion. So here maybe my students or my dear colleagues, do you have any question you can ask directly, or even maybe like barrier language, Professor? I will help them to translate it in English. So anyone, do you have any questions to our Professor? I think mostly they are so shy, Prof. They're so impressed until they speechless. Okay, there is a question from Ma'am Aryani. Ma'am Aryani, can you speak directly to our professor? Okay, Ma'am Aryani is our head of undergraduate nursing program, Prof. Hello, Ma'am Aryani. Could you please?
I can read the
Professor. I'm not sure my connection is good, Mr. Deri.
Oh, it's good, really clear.
Okay.
Can you?
Good afternoon, Professor Ros.
Hi, good afternoon.
Nice to meet you again. And so amazing your curriculum fitted and what you said about the clinical academic. I agree with you. Agree on Professor. But my question, Professor, maybe for a little discuss about what we do and what's we have now about the nurse in clinical and nurse in academic, or maybe for a student. Please tell me if my connection is not good, yeah, Mr. Deri. Okay.
It's okay. I can hear you.
Thank you, Professor. Really to improve the quality of education and also the quality of service, Professor. also in accordance with one rules as a nurse is about the nurse researchers, but I think this just my opinion and what I know from now. Uh, in this time, there are many researchers from academic, from especially from the students are with their study in the campus. But for nurse in the clinical, in the hospital, I'm not sure there are so many researchers from there. So for your opinion, Professor, what's the thing important what we have in the future as a nurse, Professor?
Yeah.
That can make increase awareness to implement evidence-based practice. Thank you, Professor.
Yeah. I think I got most of that. You broke up a little bit, but I think so. I'm going to try and answer your question, and I hope I'm answering the right question. But so tell me if I'm not. I mean, I think there's a lot that we can do, and I think it starts from the beginning in day one. As soon as we start our training as students of nursing or other professions as well, to have research embedded within all of the training. So even if you're doing a module that's very clinical, say about some clinical skills and so on, there's no reason why that module shouldn't have research skills embedded in it. So for example, even if you are having students to read the literature to inform maybe some clinical skills, it's about how do you read the literature? You know, how do you read it with a research head on, not just read it and understand it and take it away. It's about read it and unpick it and really dig into the literature to make sure that you are properly analysing and critiquing it. So that's an example of a research skill that can be taught just inside any module, really. And I think it's looking at within our training programs, our degree programs, what other opportunities are there for student nurses or student allied health professions to do research. So quite often we try to link up with sometimes academics who are working completely in the university have got data that they might have finished a study, but they, you know, especially with qualitative data, there's always analysis that can be done. So it's how do we link students up so that the student has an opportunity to analyse that data, write it up into an article and develop those skills. And those skills that can be then taken forward into clinical practice once they qualify, and they can carry on using them when they're, you know, reading the literature as a qualified nurse. I think the other thing that can be done is sometimes the modules that the students do are about improving practice. So they can actually choose something while they're out in their clinical placements to maybe notice something that maybe could do with some improvement in the clinical setting, and then work around that, research around that to try and come up with some answers that they can take back to their clinical placements and help to inform and move practice forward. I think sometimes when people qualify, it can become a bit more tricky, because if you're working full-time in a clinical placement, you're so busy every day with delivering your nursing care. Where do you start to think about time to do research? And I think for most people that is the main problem. And I think, but also there might not be the expertise. You might have only done some nurse training and research in your training, but not enough to be able to actually lead on a study and initiate it. And so I think that's where relationships between universities and the health sector are really, really important. So that as a nurse, you could feel that you can just email somebody in the university and say, I've got this idea, can you help me? You know, how do we bring people together? Because sometimes actually academics, you know, we sit in our offices, we deliver lectures, they can be quite removed from the clinical reality, and they might not know what needs to be done other than from reading the literature and looking at recommendations from previous research. It's hard to know what the actual priorities are. And so actually having a nurse ring them and say, I've noticed that there's a problem, they might be waiting for that call because that gives them their next project. So actually that collaboration, I think, is really, really important, and bringing down those bridges between the sectors can help to get the right people around the table at the right time. Does that answer your question?
Yeah, I agree with you, Professor. So the conclusion is not just we as a researchers, but we as a collaborator. That's so important, right, Professor?
Yeah, absolutely.
Thank you so
Absolutely.
much, Professor. Thank you,
You're
Mr.
very
Deri.
welcome.
Thank you, Mama Rieni, for the question and for great answer, Professor. I think there is another question from my students. To Silpi, please.
Okay, thank you. Good afternoon, Professor.
Hi.
Thank you for this great opportunity. Introduce, my name is Selfie, NPM 11212336, majoring in nursing. Let me ask, we can see the many benefit of evidence-based practice. Are there any weakness in evidence-based practice, and how to sort or choose some research as a reference material for making evidence-based practice? Thank you.
Yes, thank you. That's a really good question, Silpi. Thank you. I think you're right, because often as I say, there's so much evidence out there, and often it's contradictory. Sometimes two studies trying to look at the same thing come up with the opposite advice. You know, so the evidence isn't always straightforward. And one study might be recommending one particular way of delivering care, and another study might be recommending the opposite. So what do we do in that context? And I think that's where having research skills, particularly understanding study design, really comes into importance, because if you've got, say, two pieces of evidence that are the opposite to each other, it's about how do you really understand which is the strongest evidence. And it might be that you look at what they've done, look at the methods, how strong is the evidence, how robust is that study, how good was the sampling, how big was the sample size, if it's a quantitative study, is there any bias within that? Trying to understand why they're proposing opposite advice. So it's about really stripping it back and looking at the underpinning research that's delivering that evidence. But even then, you don't have time to do that on a day-to-day. So I think that's where, as I said before, you know, literature reviews do that for you. So if you're interested in the best use of a particular, I don't know, particular dressing for a wound, and you don't know, there's lots of different evidence out there. If you can identify a literature review that's already unpicked all the available evidence and brought it together for you, summarizing then, you know, the next steps. But that's not always available. So I think if in doubt, it's about doing things by consensus. So maybe if you're as a clinical team, you might be trying to think, okay, what care do we need to deliver in this setting? Let's get together and maybe have a discussion about the evidence that's available and reach a consensus between you as a group of experts about how you're going to do it as a team on your particular clinical setting. But I think another caveat to that is, of course, and so you ask about limitations, of course, the major limitation will be if the patient doesn't want it, you know, because the patient should be at the center of this decision making. If you've got a choice of ways of delivering care, then the patient should be part of that discussion, because they can influence. If there's a choice of remedies, for example, then the patient can influence those decisions, because they are the person receiving the care, and they're the person ultimately that has to provide consent to receiving that care. So I think it's about having open dialogues with patients about what their preferences for treatment are. Does that answer your question, Zippy?
Yes, thank you so much, Prof. I hope that answer your question, Silpi. Yeah. Semoga
Oh,
menjawab
handsome.
ya.
Thank you so much, Professor.
Yes, Prof. Ros Kane. I think may I add my perspective also, because relate to my previous students asking you about this evidence practice. I do agree with what you said before, because we need to integrate this evidence as our innovation also, right? Because like there is in this era of globalization, there is always the latest, maybe the latest update knowledge that we have to improve our innovation in our nursing care delivery. So I think the main goal or the main outcome is to improve the health status from our patients, right? So therefore, this is very important. However, we cannot ignore from integrating evidence practice in our clinical practice, even in education also. It started from academic, right? And after that, they have to practice it. Okay, Professor Ken, is there we still have time? I mean, for the rest 5 minutes left. Maybe is there any question from my students or maybe their college? So I think regarding to your explanation before, Prof, regarding about, yes, we have to search evidence. One of the challenges, we have to resume or we have to search so many articles, and not all articles in good manner. I mean, from the methodology. So maybe can you share your experience how to integrate it? Should we criticize the article first by like critical appraisal, using something tools that to see this is appropriate to implement into our clinical practice, or only like panel expert it's enough, or something like that? Can you share your experience, Prof? Thank you.
Yeah, I think you're right. I think there are a whole suite of really useful critical appraisal tools available for free now that I'm sure you have got access to, that help with different study designs, to really help you unpick the robustness and the quality of those studies. The difficulty with that is that it takes time. So, and you know, if there's 40 or 50 articles written, that it's a big job to use a critical appraisal tool for all of those, because you might need an answer more quickly than that. That would be a good student project, though. It would be a really good dissertation, for example, to really, you know, invest the time into applying critical appraisal tools to all of that evidence. But on occasion, people, as I say, will have done that for you already if you can find a systematic review. But I think as well, you know, often make good use of clinical guidelines, because actually clinical guidelines in organizations are often, you know, they should be based on the evidence. So somebody, I don't know how the sort of health infrastructure works, but often there will be a sort of quality office within healthcare providers who devise clinical guidelines, and they're based on evidence. Now that might be at a local hospital level, or you can use, you know, for example, in the UK, we have an organisation called the National Institute for Health and Care Excellence, which one of the main remits is to produce clinical guidelines for best practice for delivering, you know, a whole range of different types of care for different symptoms and different, you know,
yes, should involve many parties.
Yeah, and so the NICE guidelines, as we know them, are, you know, they're really, really, really robust. The amount of work and the number of academics that get involved in devising and updating NICE guidelines is really, I mean, it's a really very, very valuable resource. and they use very wide-ranging literature, and they've got whole teams of experts and clinicians work together to devise those guidelines. So often, for us, that's the first place to start, because that work has already been done for you. And often they sometimes they advise care that becomes kind of mandatory as well. This is what needs to be done in this situation, sort of thing. So that's, using recognized and robust published guidelines that by sort of established organizations is definitely a kind of good practice.
Yes, Prof. Unsurprisingly, actually, for Indonesian, especially Indonesian student, especially my students, Prof, I asked them, proposed them to motivate them to read the articles in English, because English is like our most challenging, because this is not our native language, mother language. So by searching article in English, by searching in electronic database journal, I think besides we improve our insight, we can update, and also we can improve our vocabulary and grammar. So therefore, they can improve their English also. I think so many advantages. Because this is
definitely.
like
it's not fair. It's not fair.
Unsurprisingly, because this is because our native language, so therefore maybe mostly student can understand but difficult to speak. So thank you so much, Professor. It's a really great explanation and experience for all of us here to improve that. If we speak in Bahasa, and then we have to learn English, because it's compulsory like vaccine, right? It's not weird if you can speak English fluently, but this is I think one of way to improve my students. They can directly to motivate them how to be brave internationally, like as we know, this is like our way to help them, to motivate them, something like that, Prof. Okay.
Yes.
Thank you so much,
Prof.
Prof.
It's biased that a lot of the stuff is in English. It's very biased.
Yeah. So lovely experience for all of us here, Professor. I think because all our time is over regarding to our agenda, you still have another agenda. Once again, Professor, thank you so much for your opportunity, for having been accepted our invitation. It's a really big such an honor for all of us here to have you, and I hope we can see you in the next project, Professor. Stay safe, stay healthy for all of us here. Once again, thank you so much. But before we end our class, or before we end our lecture, maybe I would like to propose to see you the certificate. This is as a reward from us to you as our speaker of our visiting program. Allow me share the certificate for you as our reward for this event.
Oh, that's lovely. Thank you. And thank you so much for having me. It's been a real pleasure.
Yes, bro. Okay, let me share. Allow me to share.
Wow,
yes, Professor. This is our certificate presented to our Professor Dr. Ros Kane as a speaker of visiting professor in our routine program, Glory Guest Lecture of Rajawali Nursing MIDWIFERY, organized by Institut Kesehatan Rajawali in collaboration with University of Lincoln, UK on March 3rd, 2023, signed by Vice Rector of Academic Affairs, Dr. Eni Kusmira, and by me as a Director of International Affairs. Once again, thank you so much. Thank you for all the participants, my students. See you in the next project. Bye-bye.
Thank you, everyone.
Thank you so much, Professor.
Thank you, Prof.
Take care.
Thank you.
Yeah.
Bye-bye. Thank you.
Oke, terima kasih semua teman-teman.
Happy birthday, guys. Kita baca doa dulu untuk Pak Deri. Happy birthday, happy birthday.
Itu selamat ulang tahun.
Selamat ulang tahun.
Selamat ulang tahun, Pak.
Bapak.
Selamat ulang tahun,
Sudayana.
Pak. Semoga panjang umur, sehat selalu.
Amin.
Panjang umur, sehat.
Amin.
Selamat ulang tahun Pak Deri.
Selamat ulang tahun, Pak Deri.
Selamat
Ya,
ulang
ya.
tahun.
Atur nuhun semuanya
Selamat
ya.
ulang tahun Pak Deri.
Ini di record loh. Ini di record. Bu. Ya, see you ya teman-teman. Terima kasih atas partisipasinya hari ini. Semoga bisa bertemu di next project ya. Terima kasih. Barangkali